Hello, everyone, and welcome. Have you ever found yourself sitting or lying in one position for a long time, perhaps while reading a good book or watching your favorite show, and then felt that nagging discomfort, or even noticed a tender spot on your skin afterwards? Or maybe you've worried about a loved one who isn't as mobile as they used to be. It's a common experience, but it can sometimes be a quiet signal from our bodies. Today, we're going to talk about something incredibly important for our well being, especially as we get older. Simple yet effective ways to care for our skin and prevent a common but serious problem called pressure ulcers, or as many know them, bed sores. Now, these aren't just minor annoyances. Pressure ulcers can be surprisingly painful, can lead to serious infections if not managed, and can significantly impact your independence and overall comfort. It's easy to think, oh, that won't happen to me. But the risk is real, particularly if our mobility becomes limited, even temporarily. It's not just about the sore itself. It's about how it can steal away your ability to enjoy daily activities, make you feel dependent, and add unnecessary worry to your life. But here's the empowering part. Prevention is largely in our hands. In this video, I'm going to share 3 crucial areas you need to focus on as simple, practical strategies that you can start using today to protect your precious skin and maintain your health and comfort. These are things you can do for yourself or help a loved one implement. Before we dive into these essential tips, if taking control of your health and comfort is important to you, please take a moment to click that like button right now. And if you haven't already, consider subscribing to our channel and ringing the notification bell so you don't miss out on more helpful advice like this. All right, are you ready? Let's get started with the very first key to keeping your skin healthy and resilient. Point 1. The power of movement and regular repositioning. Our first and arguably one of the most vital strategies is all about movement and regular repositioning. So why is this so critical? Well, when you stay in one position for an extended period, constant pressure on certain areas of your skin, especially over bony parts like your hips, tailbone, shoulder blades, heels, and elbows, can dramatically reduce blood flow to those tissues. Think of it like standing on a garden hose. The water, or in this case, blood, can't get through properly. Without adequate blood flow, the skin and underlying tissue don't receive enough oxygen and nutrients, and they can start to break down, eventually leading to a sore. Let me tell you about my friend Michael. After a hip surgery, Michael was understandably hesitant to move much. He spent long hours in his recliner. His wife, Susan, noticed a persistent red patch on his lower back that didn't fade even when the pressure was off. Thankfully, Susan had read about pressure sore prevention. They started setting a gentle timer. Every hour, she'd help Michael shift his weight, even if it was just leaning to one side for a bit or adjusting his pillows. If he was in bed, they aimed for a position change every 2 hours. It wasn't a huge effort, but that small change made all the difference. The redness disappeared, and Michael avoided what could have become a very painful and difficult situation. It truly highlighted how consistent, small actions are key. For you, understanding this means recognizing that by simply shifting your weight frequently or being assisted to change positions, you're actively nourishing your skin from the inside out, preventing that breakdown, minimizing pain, and significantly reducing the risk of infections that can accompany open wounds. So, the practical takeaway here is if you're primarily in bed, aim to change your position at least every 2 hours. If you spend a lot of time seated, whether in a wheelchair or a regular chair, try to shift your weight every 15 to 30 minutes. Even small movements, like lifting yourself slightly if you're able, can provide immense relief to vulnerable skin. Point 2. Diligent skincare and daily inspection. Next up, let's talk about diligent skincare and the importance of daily inspection. Your skin is your body's first line of defense, and keeping it clean, dry, and well moisturized is fundamental. Healthy skin is more resilient and less prone to breaking down. When skin becomes too dry, it can crack and become fragile. If it's too moist, perhaps from sweat or incontinence, it can become soft and more susceptible to damage and infection. It's about finding that healthy balance. I remember a lady from our community, Eleanor. She was quite independent but had developed diabetes, which can affect skin health. She started noticing some itching and dryness on her legs and back, but didn't think much of it. One day, her daughter, while helping her after a shower, noticed a very small, tender red area on her heel that Eleanor hadn't even felt. Because they caught it so early, it was just a stage 1 pressure injury, a warning sign. They were able to take immediate action. They made sure her skin was gently cleansed daily with a mild soap, carefully patted dry, no rubbing, and a good moisturizer was applied. They also got her a special cushion for her heels. That little sore never progressed, all because of that daily check and gentle care. What this means for you is that taking a few minutes each day to care for and look at your skin can be one of the most powerful preventative measures you take. It's not just about hygiene, it's about early detection. Catching a problem when it's just a small red spot is much easier to manage than dealing with an open wound. So, what are the practical steps? Cleanse gently. Use lukewarm water and a mild pH balance cleanser. Avoid harsh soaps that strip the skin. Pat dry carefully. Do not rub, especially over bony areas. Ensure all skin folds are dry. Moisturize. Apply a good quality, alcohol-free moisturizer to keep skin supple, especially after bathing. Inspect daily. Check your entire body for any red areas that don't fade when pressed, blisters, tender spots, or broken skin. Pay close attention to those pressure points we talked about. Use a mirror for hard-to-see areas, or ask a family member or caregiver for help. If you're finding these tips useful, let me know in the comments by typing helpful skin tips, and don't forget to subscribe if you haven't already. Point 3. The vital role of nutrition and hydration. Our third essential pillar in preventing pressure ulcers might surprise some, but it's absolutely critical. Good nutrition and staying properly hydrated. Think of your skin as a house that needs strong building materials and constant maintenance. Food provides those essential building blocks of protein for tissue repair and strength, vitamins like vitamin C and A for skin health and healing, and minerals like zinc. Water is crucial for keeping your skin cells plump, elastic, and functioning correctly. If you're not getting enough of these nutrients, or if you're dehydrated, your skin becomes more fragile, thinner, and less able to withstand pressure or heal quickly if damage does occur. Let me share a story about Mr. Harrison, a gentleman I knew from a senior activity center. He'd been struggling with a persistent sore on his ankle that just wouldn't heal, despite good local wound care. His doctor eventually referred him to a nutritionist. It turned out his diet was lacking in protein and certain vitamins because he found cooking for one a bit of a chore. The nutritionist worked with him to incorporate more lean meats, beans, colorful fruits, and vegetables, and emphasized drinking more water throughout the day. It wasn't an overnight miracle, but slowly and surely, as his nutritional status improved, his skin quality visibly got better, and that stubborn ankle sore finally began to heal. It really drove home how much what we eat and drink impacts our skin from the inside out. This means that focusing on a balanced diet and adequate fluid intake is a proactive step you take every single day to fortify your skin. It's not just about wound healing, it's about building skin that's strong enough to resist breakdown in the first place. Practically speaking, aim for a balanced diet rich in protein like fish, chicken, beans, eggs, dairy, plenty of fruits and vegetables for those vital vitamins, and whole grains. And don't forget hydration. Sip water throughout the day. If you find plain water boring, try infusing it with a bit of fruit or enjoy herbal teas. Your skin will thank you. Now that we've covered our 3 main strategies, let's dive a bit deeper into some practical specifics and common pitfalls. Beyond mild soap, consider using no-rinse cleansers if bathing is difficult. Always test new products on a small skin area first if you have sensitive skin. And for moisturizing, apply it when the skin is still slightly damp to lock in moisture, but avoid putting lotion between the toes unless specifically advised, as this can sometimes promote fungal infections. Focus on the tops and bottoms of the feet and heels. Common mistakes to avoid. Ignoring early signs. That persistent red spot that doesn't turn white when you press it, this is called non-blanchable erythema, is a critical stage 1 warning. Don't wait for it to become a blister or open sore. Massaging bony prominences. While gentle touch is good, vigorously massaging bony areas can actually cause damage to underlying tissues, especially if they are already under stress. Using donut-shaped cushions. These can actually worsen things by creating a ring of pressure and restricting blood flow to the area in the middle. Opt for pressure redistributing cushions recommended by a healthcare professional. Allowing skin to remain wet, whether from sweat, urine, or stool, prolonged moisture breaks down the skin. Use barrier creams if incontinence is an issue, and change wet clothing or linens promptly. Alternative options. If you have significant mobility limitations, discuss specialized equipment with your doctor or a therapist. This can include pressure redistributing mattresses, alternating pressure or low air loss, and specialized wheelchair cushions. These tools can be incredibly effective, but are usually part of a comprehensive care plan. And critically, a word of expert advice. Always consult with your doctor, a wound care nurse, or a physical occupational therapist if you have concerns, if you notice a new sore, or if an existing one isn't improving. They can provide personalized advice and treatment. Don't try to manage serious sores on your own. So, to recap, the pillars of protecting your skin and preventing pressure ulcers are regular movement and repositioning, diligent skin care and inspection, and good nutrition and hydration. These aren't just isolated tips. They work together to maintain your skin's health and your overall well-being, directly impacting your comfort, your independence, and your ability to live life more fully. And the best part? As we've discussed, these are largely simple, accessible actions. They don't require expensive equipment or complicated routines. They are within your reach or the reach of those who care for you. Now, I understand that incorporating new habits can sometimes feel challenging, or it might seem like one more thing to worry about. But please, from my heart, don't underestimate the impact of neglecting these simple steps. Ignoring early warning signs or not being proactive can, unfortunately, lead to prolonged pain, difficult to heal wounds, a greater risk of infection, and an unwelcome loss of your precious independence. I've seen firsthand how a preventable pressure sore can set someone back significantly, and it's truly heartbreaking when it could have been avoided. But here's what I really want you to take away. You have the power to influence this aspect of your health. It is never too late to start prioritizing your skin. Every time you shift your position, choose a nutritious meal, or take a moment to inspect your skin, you are making a conscious choice for a healthier, more comfortable future. Age is a part of life, but how you choose to live those years, with comfort and dignity, is largely up to you. You absolutely have the power to choose a better path for your skin health. As we wrap up, I hope you can see that dedicating a little consistent attention to your skin isn't just about avoiding a medical issue like pressure ulcers. It's fundamentally about preserving your quality of life, your ability to move freely, to engage with the world, and to enjoy your time with loved ones without the unnecessary burden of preventable pain or serious complications. Now, I'd love to hear from you. After watching this video, what's one skincare tip or strategy that resonated with you the most, or that you plan to be more mindful of starting today? Or perhaps you have a personal experience or another helpful tip that has worked well for you or a loved one. Please share your thoughts and experiences in the comments section below. Your insights could be incredibly valuable to someone else in our community. If you found this video helpful and believe it can make a difference, please give it a thumbs up to support our channel. And if you haven't already, please click the subscribe button and the notification bell so you won't miss our future videos packed with practical health advice. And most importantly, if you know someone, a friend, a family member, a neighbor, or a caregiver who might be struggling with mobility or could benefit from this information, please share this video with them. A simple share can provide vital knowledge and make a real positive impact on someone's life. Thank you so much for joining me today. We wish you and your loved ones the very best of health, comfort, and happiness. Stay safe, Take good care of yourselves and each other, and we look forward to seeing you in the next video.